Right, Martins. Good morning, everyone. It's a great pleasure to be here moderating this panel. And over the next 70 minutes, we're going to have a great chance of talking about healthcare in Portugal and its model of governance. And we'll have the pleasure of listening to the former Minister of Health from Portugal, Adalberto Campos Fernandes, professor of the Public Health School in University Nova Lisboa. Thank you very much for being with us, Minister. And debaters, after Minister Fernandez speaks, we are going to have our former Minister, José Gomes Temporão, to debate along with the State Secretary or a Secretary of the Department of Science, Development and Technology of the State of São Paulo. Patrícia Ellen will be with us to debate right after we hear to Mr. Adalberto Campos Fernandes. So I'd like to thank Minister Temporão, Patrícia Ellen, for the availability of being here with us. And I would like to give the floor to a former Minister of Health of Portugal, Professor Adalberto Campos Fernandes. Thank you very much. Good morning. I think that it's still good morning in Portugal, and in Lisbon in Europe, it's already the afternoon. I would like to thank you very much for the invitation, and especially to José Villar. And I greet Patrícia Ellen and my colleague and my friend and my former peer as a Minister of Health, José Gomes Temporão. It's a pleasure to be with us. I have a short presentation, and I'll try to stick to the time that has been allotted to me. And I would like the support of the technical team, if possible, for me to show the slides that I have here to share with you about the Portuguese healthcare system. Okay, so here is the slide. So we are already seeing the slides. Thank you. Afterwards, I'm going to ask something. I'll tell the people who are sharing the slides. So just next for you to shift through the slides. I'm going to make a brief description, the previous slide. So I would just like to mention a landmark in Portuguese healthcare system. Portugal became a democratic state in 1974 with a democratic constitution of the Republic in 1976 and a law that is very important that we call Arnaud law because it was created by the Social Affairs, Arnaud, who created this act, creating the national healthcare system in 1978. And this is the national healthcare system, followed the British model, Beveridge, right after the World War II in 1948 was created. And Europe made a political decision of repairing all the bad things that its people had suffered. And there were something that was solidary and that was a social welfare in many of those states. The public healthcare system in Portugal covers the entire population. It's universal coverage and it covers anything. It has a socio-economic institute, regardless, and they cover regardless of anything. It's for everybody, regardless of race, gender, or anything else. We also have some subsystems in health that are special regimens that provide coverage for certain professions. And some of them come from the new state, and they have a nature that they are professional associations. Portugal is an European country. It's small. Of course, compared to Brazil, it's very small before going live. Brazil is not a country, it's a continent. It's a huge nation, very, very big, amazingly big. But for European scale, Portugal has an expenditure that is close to 17 billion euros in public expenses. And public expenses represent 2/3 of total expenses or expenditure. In 2017, Portugal spent on average 2,029 euros per capita in healthcare, which is 1/3 of the average in European Union. And this doesn't mean much because we don't have much financial capacity or all the financial capacity that we should have to allocate to the healthcare system. But at the same time, Portugal is one of the most efficient countries in the OECD because even so, we have very good indicators and very good results. On the last decade, direct payment have increased and reached 27.5% in terms of total health expenditures. Portugal today is the 5th most efficient country in the world. I don't know if in Brazil you knew this, but we have a trajectory of that people are getting older and older. A woman in Portugal today lives longer than, in terms of life expectancy, than a woman in Northern Europe, which is very unusual. 30 years ago, our life expectancy was very, very low. And we were very far away from the indicators in Northern Europe, but now life expectancy has increased greatly. We have healthcare problems that worsened over the past 10 years. Similarly to other countries in Europe, we have a very significant burden of chronic diseases. So we need to increase now life, not just in number of years, but also in quality. And we have one of the lowest mortality rates by avoidable diseases in the European Union, 140 deaths for every 100,000 inhabitants. Similarly to what happens in other countries, I think that in Brazil, for transmissible diseases, the most relevant have changed their epidemiological profile, differently from cardiovascular diabetes and cerebrovascular disease. The traditional paradigm that we know 30, 40, 50 years ago of acute diseases has been progressively changed by the burden of non-transmissible diseases, and so this required a new strategic approach model by the healthcare system with more focus on public healthcare, health promotion, and disease prevention. This is when we define midterm strategies. And this is a phenomenon that is going through all over the world and that has aggravated or heightened with COVID-19, with discontinuity and the risk of transmissible diseases make non-communicable diseases on the whole similarly to what happens in richer countries. In Portugal, since the 1990s, there has been a significant increase of the population aged equal or more to 65 years of age. This means that in 2060, if we don't do anything, the resident population will be from 10 million to 8.6 million people, with many implications on the capacity of generating income to subsidize the health protection systems. So the aging rate will go from 131 to 307 elderly persons for every 100 young people, and there will be a reduction of 20% of young people and children whose age is lower than 25 years. This is the main threat that Portugal will be dealing with over the next few decades. It's this demographic transition, aging of our population that is going to be very fast. So Portugal has been developing over the past 40 years of the existence of its healthcare system, a structured and wide-ranging network, very much centered on the primary care. In 2018, the coverage of citizens through the family doctor was more than 94%. And after 2016, the health centers and the respective clusters started to make available to provide oral health, visual health, clinical psychology, and complementary and diagnostic therapies. The health centers are organized in family health units, which are teams that have a professional autonomy and performance being assessed, and they receive compensation related to their performance. At the level of hospitals, we have been following up the trends in Brazil, and Brazil is a leader in many of these areas. We have increased outpatient surgeries, so we have 60.7%, but now we actually have 4% of our surgeries are in the outpatient systems, and we also have day surgeries when you want to reduce length of stays in our hospitals to the strictly necessary because of the condition of the patient. And we also launched in 2006 and 2007 two complementary networks, a very important continued care network and palliative care for the patients who leave the hospitals and stay home. They have some sort of chronic disease, but we want to keep them outside the hospital. And then we created palliative care too. In terms of human resources, our number of doctors, it was one of the highest in Europe. It's about 5 doctors for every 1,000 inhabitants in 2017. Unfortunately, still, even though in the last year we have made a great effort to hire and recover the number of nurses, we are below the average of the EU, 6.7 as compared to 8.4. But in the medical population, there's an imbalance in demographic. For many years, Portugal has had high numbers of specialties. So this mid-generation suffered from that, and right now we have a significant number of doctors in certain specialties, and young doctors are not yet enough to replace the ones who will retire. So this creates a problem. Even though Portugal is a small country, this is a reflection of everything that we have there, and the unbalances, especially between urban and rural areas. The public sector has lost competitiveness because we have a very strong and dynamic private sector right now. In Portugal, we have about 5 million with public coverage that is social, is mandatory. And so that are access to the subsystem, and there's a very important and dynamic network of private hospitals in Portugal that is sustainable, and we have used them for the past 10 or 15 years. In terms of the economic and financial crisis, we have changed the expenses with medication generics. Right now we have almost 48, as you can see, on this chart, and this contributed for the system to become more efficient, not just in terms of generic medications, but also biosimilars now account for a large number in private hospitals. We also have placed great importance to a good innovation, disruptive innovation of medications that are very effective and favorable. And this happened, for example, with medications. One of the success cases in Europe in the cure and treatment of patients with hepatitis C all over Europe. And here on the chart, you can see that in 2012, which was, you can see the lower numbers because this is when our crisis was the worst, but then it got better. Also have invested on digital transformation. Digital transformation today, right now, we are dealing with a pandemic crisis, and today we are 96%, and we have a set of tools that make it possible for us to make the relationship between the healthcare system, doctors, and patients. We have a contact center, and then we provide care to our citizens. We have an electronic system and a citizen area in our website, and each person may have access not just to their own information, but they can also interact with the healthcare systems and units. And in 2018, we were very proud, and Portugal consolidated and kept its position as ranking that is published every year by Euro Health Consumer Index, and Portugal is 13th, very close to countries that are very rich, such as Germany, France, Austria, Sweden, that are on the first part of the table at the top, the more developed countries.
We ranked 13th in terms of healthcare, and we used to be much lower. So it means that health is performing much better than the other sectors where we ranked 23rd among other countries. I have covered it very briefly because I would like to have further interaction. But I have one last slide to share with you one of my reflections here. In Portugal, there are some problems that are faced by Europe, America, Brazil, and the whole world, everything that had been enhanced by the COVID-19 crisis. We have huge challenges of strategic nature. We have to deal with all the different players, really different from what used to be 20 or 30 years ago. There is a great impact of the private sector, and we should always take into account the interest of our citizens. And we are absolutely sure that a sustainable system for the world, for the whole environment, would require equipment, infrastructure, and human resource strategy. In Europe, professionals have difficulties to go from one country to the other. Here in Portugal, we have excellent medical training, and our physicians sometimes are recruited to work in other countries where they get higher pay. It happens in different countries of Europe. Considering the aging of the population, something common to the whole world, we also have to consider chronic diseases. Of course, technology is disruptive, but it's also costing more and more. And I think the pandemic has brought about the importance of public health. This is going to redefine the way we have been considering public health throughout the world. And as literacy improves and knowledge level improves, of course, we have to count on the participation of all citizens in the healthcare system, because the systems exist to serve people. Thank you very much for your attention, and I'll be glad to entertain your comments and questions. Thank you. Thank you. It's always wonderful to hear from our sister country. Now I would like to hand it over to Minister Temporão. He is someone widely experienced in public management, someone who is really committed with our healthcare system, inspired in the British system. So, former minister, you have the floor now. Good afternoon, everyone. Let me start by greeting Leandro, who is our moderator. My dear friend and former Minister Adalberto Fernandes, I met him at the end of last year in the meeting of the Academy of Medicine in Brazil and Portugal. It was in Oporto. And Patrícia, Ellen, it's a pleasure to be here with you. Let me try to draw similarities and differences among our countries based on the presentation of former Minister Adalberto. Portuguese and Brazilian healthcare systems were created within the same context of re-democratization. Portugal was living long years of dictatorship, and Brazil was living its military dictatorship as well and the fight for democracy. Portuguese and the Brazilian SUS are really impacted or have been impacted by health within the context of development and the role of government. There are a number of differences. Brazil is huge, more than 200 million inhabitants, but there is also the health expenditure, which is nearly 70% paid by the government. In Brazil, it amounts to only 46%. Most of health expenditures in Brazil is in the hands of employers and households. So we are far from this factor, which is really important for the creation of a universal healthcare system. Epidemiological profile is quite similar, but in Brazil there are two main differences. We have high prevalence of infectious contagious disease leading to high morbidity and mortality. And there is a negative characteristic in Brazil, which are traffic accidents, car accidents, and also murders. Last year alone, there were 100,000 deaths caused by traffic, car accidents, and murders. So structural violence in Brazil is something really that makes a difference. These two systems are based on really primary care support. Primary care in Brazil, that we call family health, is a structuring pillar. And, of course, a difference that we have is that in Portugal, there are many more physicians and nurses than what we have in Brazil in terms of population. And the fact that we have a large territory, there are regional differences. And also a difference between the urban areas and the outskirts of the metropolitan regions. So it really impacts the access to medical care. Portuguese market has over 40% of use of generics. In Brazil, we have about something over 30%, but there has also been major advances in this issue. Let me point out some key differences. In Portugal, there is an important infrastructure also of palliative care. And Brazil is starting its journey towards that. we still do not have a good national plan for it. National capital, electronic medical record, use of telemedicine. This is something that has evolved much more in Portugal than in Brazil. If I may add, let me point out a number of Brazilian characteristics that really emphasize our singularity compared to Portugal. First, our inequality, social inequality in Brazil. Secondly, the fact that Brazil is a federation, and we have really been innovators in a number of things. As all our cities and states are independent before the federal government, all Brazilian public healths go through intermanagement committees. So city, state, and the federation come to consensus and approve policies which are executed and implemented by the cities, states, and co-funded by the three levels. Another very important element to our universal healthcare system is the participation of society. We have health councils, we have a national council, state councils, and over 5,000 city councils with participation of the society, and healthcare conferences that every 4 years discuss, approve, and propose to the society the implementation of policies and guidelines. We also have external control, which is part of the governance of Brazilian healthcare, which includes the audit committee, the public prosecution office, which also play an important role, much more important in recent years, because of poor use of resources and low efficiency, and it has gained more and more political colors. We still have got a lot to do in terms of transparency. In Brazil, we have a limited level of transparency only concerning budget. We don't have a national policy of hospital accreditation or a system where we share our accounts. Let me talk about one thing which is very unique to Brazil, and it's what we've been doing since 2008 to strengthen technology incorporation, development of local technology, and reduction of external resources. And let me conclude by giving you two examples. Brazil, differently from most Latin American countries, which in the 80s and 90s closed their public plans of immunobiologicals and vaccines, we did exactly the opposite. For the past 3 decades, we strongly invested in structuring the public plans to produce immunobiologicals. And this is why we are at the avant-garde. This is why we are testing 2 of the most promising vaccines to be out in the market within the next 2 months. And we have Fundação Oswaldo Cruz and Instituto Butantan. Brazil spends 300 million doses of vaccines and immune biologicals. 95% of vaccines are manufactured in Brazil in our own plants. And it was structured through a very intelligent partnership between multinational companies and public entities through technology transfer. So these were my contributions to the discussion. Thank you very much. Thank you, Minister Temporão, for your initial comments. I would like now to hand it over to Secretary Patrícia Allen for her initial remarks about our Brazilian system in opposition to the European and Portuguese system. You, who are actively right now in management, is it easy? Well, of course, it's really difficult to speak after two top ministers, Minister Temporão, Minister Adalberto, someone who are extremely smart and seasoned in their functions. Before joining the government, I used to work in a health technology company of United Health Medical Care, largest healthcare management company in the world, owner of Optum. And now, with the government under the Secretary of Economic Development, Science and Technology, I agree, Leandro, science and technology has been our key priority. Not only respect to science, but through respecting science, we can also respect lives of the population. I am also the leader of COVID-19 committee. I work for the state of São Paulo. And also we have here the governor of São Paulo being part of it. The first thing that was thought by the pandemic is the importance of integrating health with the whole government, integration of data, and integration between public and private entities. I'm going to make some comments about that were made by our former speakers, correlating with the Brazilian reality, and I'm going to focus my comments on aspects concerning technology, inequalities, and the important legacies that we are going to take from the pandemic. Concerning similarities, population aging is something that has impacted our two countries. Brazil is one of the few underdeveloped countries that has experienced a change in life expectancy. The population aged. Within 6 years, there was an increase of 26% of the population over the age of 60, and our estimate, based on information for the new census, that up to 30 million of elderly people are Brazilian citizens. Therefore, our challenge, and I published a book 1 year ago with Claudio Lutemberg and Sidney Kleiner about digital revolution in health. And we've talked about aging of the population before reaching prosperity has brought to healthcare system exactly what the minister had described, which we call a triple load, triple burden. So we have chronic disease, the main cause of mortality in the country, and we also maintain the strong presence of infectious contagious disease, which increased its trend in recent years. So malaria, yellow fever, dengue fever, chikungunya fever. And we also have external causes of disease. So 3 systems in one. Just for us to have an idea of the impact on healthcare expenditures, no countries have to create 3 systems providing independent models. So emergency, urgency, infectious disease involve prevention, chronic disease requires palliative care. So we are working here with 3 systems in one. In addition to the achievement of SUS, it's the only integrated universal system. This is another topic that we've been hearing from Canada and Europe and Australia. The population openly discuss the model of coverage, and it's a cultural challenge in Brazil, what is covered and what is not covered. In the Portuguese system, or NHS in the US, it's very easy to have access to what's covered and what's not covered. This is not discussed in Brazil, and as a consequence, there is a parallel discussion in the legal arena, creating a second Ministry of Health just for judicial application. So this is an additional challenge with the aging of the population and a system that needs to improve its quality we've had some estimates integrating the whole healthcare chain, and considering what Minister has said, if we had taken the necessary steps to cover palliative care, to expand primary care, to expand secondary and tertiary care, it would mean to have a threefold increase in healthcare expenditures. Together, public and private amount to 10% of GDP. If we maintained our current cost structure, it would mean investments of 25% of Brazilian GDP. Yes, we have to keep on expanding, but at the same time, we have to make a radical change in cost. And this is the role played by technology and also management practices and transparency. We need to take additional steps, and I've been saying that the pandemic has created a window of operation. But to do that, we need to create a model to adopt practices that were used during the situation of emergency because of the pandemic. Now, going into technology, we really have to understand that as Brazil has a triple burden, inequality, low per capita GDP, we do have some additional challenges to take this step of management. Technology can be a good solution. For example, Internet of Things. If properly applied, it may bring benefits of almost 1 trillion BRL per year, reducing costs, improving quality of life, and using cost efficiently. Studying the systems in different countries of the world, if we apply the same technologies in science, education, smart cities, the most benefited sectors are smart cities or manufacturing. In Brazil, it's health, because this is the industry that has the highest benefit of cost and also the need for expansion. So we can see here great opportunities. Seeing that from the eyes of the pandemic, and if I may give some examples of the state in São Paulo, which is the largest system within SUS, it represents 32% of all urgency and emergency services of SUS. It is the largest network of hospitals in the country. There are over 100 hospitals managed by the government of São Paulo. And in the beginning of the pandemic, we have 3,600 beds of ICU. With the pandemic, we've almost doubled it to 8,200 public ICU beds managed directly or through social organizations or PPP. It is a great legacy, providing care exactly in the necessary points, and it's a major opportunity we all face. Secondly, working with SUS and other public systems, I don't think we are at the point we should be. No electronic medical record. We have a problem with data. I've used the data. I've been working on the data system this week. You had no access to data in the state of São Paulo and 4 more states for almost 1 week. This is something that cannot happen in the 21st century. We are talking about lives and very serious decisions. So there are things to be done nationally, stabilizing database and defining one single electronic medical record. In the state of São Paulo, we created the COVID census, bringing together public and private sectors' data. It helped us monitor the occupancy rate of all hospitals in the state of São Paulo. And this is something that we need as a legacy. This management will be necessary as a result of the waiting list that has been created. Another important legacy is telemedicine. We have all been fighting to reach a good scale of telemedicine, and it's a key tool to fight inequalities. During the pandemic, there was an attempt to implement telemedicine, and this should all be provided to the population. And finally, as Minister Temporão pointed out, the investments that have been made in vaccine, the key role of Brazil, Instituto Butantan with Sinovac, and a number of other vaccines that we've been investing on, also through FAPESP. FAPESP is the incentive agency for research. So if you can please tell us about that in Portugal. São Paulo alone has funded nearly 90% of all researches being performed in the country. It's a major concern of ours. We invested 1.3 billion BRL per year. It invests in the whole ecosystem of science in Brazil, with a significant part of these resources directed to health. So it's at the same time a wake-up call to the society. How can we keep on investing in fostering agencies? With that, I close my remarks. Science is the best way to respect life. And I have one question to you, Minister Temporão. How can we bring the society to work towards health and science? Thank you, Patrícia. Such a rich panel, isn't it? We've heard from Europe, developed country with per capita expenditures, which is high, and with very good results of health. Minister Temporão brings similarities and differences with Brazil, something which is essential to make us understand how two models inspired in an English system can perform and have equal and different characteristics. And Patrícia pointed out 3 points concerning public-private interaction, coverage, and technology, emphasizing the role of technology in healthcare. Questions are being sent to us, but relying on what Temporão has said about similarities and differences, and what Patrícia has added about the importance of integrating public and private organizations, I would like to ask Minister Adalberto to talk about the integration of private and public sector in Portugal. Whenever someone has a private healthcare plan and go to a public hospital, the healthcare plan has to reimburse the government. This is a way of inhibiting the public use of system by private patients, and the coverage is offered fully for public or private hospitals. So healthcare plans in Brazil should have a complete integration without any risk limitation. So I would like you to tell us a little bit between the correlation between private and public, private risk and public risk in Portugal.
Thank you very much. First of all, I would like to thank Minister Temporão and Secretary for the excellent presentations, and I would also like to greet everyone here. And this panel is very interesting with great guests. I was listening to Secretary Patrícia, and she was talking about everything that a civilized country in the world should do in strategic points. It's just need to solve the political issues, and globally and politically, this is what we've been seeing over the past 15 years. Overall coverage and universal access. So there are public hospitals as they are in Portugal and in Brazil. And the political issue is what do countries want to do and how do they see health? There is a whole social and economic development, and health contributes for income, for productivity, and for the economy of countries. Health organizes industries and centers and research centers that add a lot of value to the country. And Brazil is one of those examples, and we've mentioned about the vaccines and the different ways that Brazil has of technological development. Therefore, I believe that we all agree that the whole world must look at humankind under the perspective that no one should not have the right care at the right time with good quality. How can we organize ourselves in terms of courses? This is a different talk. And there are countries that do that, and this is more regular in the state. Others want just something more public, some want it more private. And lastly, I would say that I agree with Patrícia Ellen. So this decision that we should have universal coverage, whether private or public or private, we should discuss. And any model needs to be what she described. It needs to be efficient, needs to create resources and advantages. And so today we really have a very good tool, which is the Internet of Things, artificial intelligence, telehealth. All of this is going to open windows, and then we'll be able to skip steps to be faster, closer to people. In Portugal, there is a separation. Those who have health insurance has access to the private healthcare do not need to pay to the state. So I buy healthcare, and then the private sector has a relationship with private providers. But they always have coverage as a guarantee. So I may use a public hospitals because I pay taxes, and therefore this is a benefit that I have access to. But I can also have access to the private system and to have to meet some of my health needs in a private hospital funded by the public system. So there is no exchange of money and funds between public and private. So every Portuguese citizen has the public system, SNS, paying minor fees or not even paying if they have low income, and those who have insurance, they use the private healthcare system, private hospitals, and there is no funding crossover between public and private. Was that your question? So yes, this was the point of the question. Minister Temporão, since you spoke, the two other things have been said, and I would like to use your experience, but I have a question to ask you. Both the Secretary and Minister Adalberto approached very clearly the coverage profile of the countries and a clarity of what is covered in the countries. In Brazil, integrality is like a blank slate, everything that doctors can do. And the process of technological incorporation is fragmented. So Anvisa lets coming to the country, and ANS and Anvisa let included in its list too. And we know that the way of technological incorporation is fundamental for a minimally organized system. So based on your experience, could you please analyze that and the difficulties of historically finding it in order to address it in an easier way here in Brazil? It's a pleasure. This is a core point. I think that Patrícia approached it very well. And so that there are historical features, and that there is a democracy, and the idea of having a generous system meeting everyone and covering all needs. But we know that in terms of offer and access, this implies expenses and availability of funds. So there's a growing impact in terms of the litigation. Brazil needs to advance like England. In England, there is the litigation culture. So there's a pact in society. They understand what the public system offers and assures this to everyone without any type of difference or discrimination. So I can see that, for example, we are here, we have a National Commission of Incorporation of Technology for SUS, and they're completely separate and they're not coordinated with the private system. We need to think of an agency like NICE in Britain to define better the process for technology incorporation for the Brazilian healthcare system, be it public or private, and to make it clear that what is outside this set of technology that has been validated in terms of technology, cost effectiveness, economic rationality, and scientific knowledge is outside. And if it's out, litigation is not appropriate. And in closing Patricia's provocation, in terms of the importance of research for development, look how difficult this is. We are in a world where denial is king. This is happening in Brazil. Our government denies science. We have anti-vaccine movement. So we need to think, what is the responsibility of those producing science, governments, the media, universities, of getting closer to society and closer to the population in a way that is educational and positive and transform a discourse that sometimes is closed in itself into explicit evidence that without science we'll never have development, we are not going to reduce inequality, and we're never going to reach equality. Excellent, Minister. Thank you very much. I think that the process of incorporation needs to be standardized. It shouldn't have differences between public and private coverage because access needs to be related to citizenship. Patricia, giving the floor back to you, I have a question, something that intrigues me and intrigues some of our listeners because I'm getting many questions. Health technology is something that people are very passionate about. So people passionately defend it or attack it. And here in Brazil, the discussion is very rough and very sectarian and very limited due to corporate interests. If we take a step back and leave aside corporate interests and think of society as a whole, I have one question, something that afflicts me. Those who defend digital transformation and digital tools relate these digital tools to a cost reduction. Whenever there is digital transformation, it comes saying that costs will go down, and I can't understand. I don't think it's possible to reduce costs if the disease burden is going up. Disease cost is directly related to the disease burden. So my question to you regards that. So there was digital transformation, but they couldn't invest in health. And investing more of public investment. And the US, too, are the most expensive healthcare in the world. And this is the home of many of those technologies. So cost needs to be left aside. This is a provocation, but it's really honest, open-hearted, and I would like to hear your opinion. I think that we have both things. The example that I gave was simulation that we ran. What would happen if we expanded everything we said with the current cost structure? We would get to a health that would cost about 25% of the GDP, which is impossible. So there are technology elements that make it possible to reduce part of that cost for us to keep the expansion and get to a cost that is affordable. I don't think we are going to reduce the current health expenditure, but the objective is to make more with the current investment. It's a slightly different math because we're well lagging behind in terms of coverage because of the challenges. So there is a work of efficiency of resource centers, underused resources. I have here in our coordination with the Technological Research Institute and working closely with Butantan and everything done by FAPESP and universities. I have many examples of resources, very expensive pieces of equipment that are only used part of the time, and with more efficient management, we can use them more. I think that sometimes we make matters more complicated than they need to be, especially when we get on the ideological discussion. You can't expand. How can you assure technology? I love mathematics, science, and programming, but we need to be good human beings. And I like to give very simple examples for us to remember what we need to do. Brazil is a very unequal country, and there's a share of the population that has access of what's best in technology in every area. If you take the example of telemedicine, specific. I am a mother. I have two 5-year-old daughters. If my daughter feels sick, I get a picture, call the pediatrician, and then there's a video call, and then he looks and he tells me, well, bring in to the office, go straight to the hospital, go have some tests. Because I, Patrícia Eller, I have the right to this, and 99% of the population are not entitled to do that. And if the population has access to that, then it's very simple. We would avoid that domino effect that we are all very familiar with. Much of the cost of the health is the wrong gateway. The population is still going to the emergency because they don't know where to go. So UBS were a huge leap that we had in basic or primary health care. But we still have a very severe problem of gateway. Also, occurrences are always, once they're much more severe. If we have the right gateway with a more preventive model, health economy, improvement in the quality of health of the population, this is going to be an immediate effect, both in terms of efficiency and improvement of quality of life. And I have many examples to give, my main benefit. I was born in the outskirts of São Paulo, and today I live in one of the richest districts in São Paulo. But my family is still in the outskirts, so this is an easy discussion. If we get into bureaucracy, you're going to spend another 20 years here talking about the same thing. I apologize, I was on mute. So, we are going back to the Portuguese system. How did digital transformation help you in Portugal to reduce costs, or did you expand access? And in my opinion, this is what happens. So it's expansion of access, and people who would otherwise not have access to appropriate health care. How did you do that? How did you conduct this transformation? And 96% electronic medical records in Portugal. This is wonderful in terms of healthcare management. I think that our moderator and Patrícia said things that can complement themselves, and they're 100% right. So Leandro said that digital transformation means that we are not have the wrong expectation that healthcare costs will go down in the midterm. They will never, because the increase in coverage, the increase in quality means that every year we need to invest more and more in health. This is taken for granted. This is something that we need to take for granted. This is going to happen. And then the health should yield in terms of result. And this is what Patrícia was saying. We need to use digital transformation in an intelligent way, in a more intelligent and less bureaucratic way, faster. But dear friends, vaccinating the entire population, costs more than vaccinating one-third of the population, and that there are other issues and other measures. I agree with Minister Temporão that unification of an agency, having a single agency that is neutral, and to have a technical work, because every technology is good, it's innovative. We need to discuss about that. We need to have redundancy. And this is the idea that we need to have access to what's best, and this is fundamental. And the key word is effectiveness. So we need to have a vaccine against polio in Africa is very effective, drastically effective. So, depending on the country, they are more or less effective. So in Portugal, we have invested heavily in digital transformation so that we become more efficient, but also so that we may make the most of everything that technology may do for us. As Secretary Patrícia said, with a phone call, we can solve a problem of a person that otherwise would lose a whole morning of work. We need to take the car, schedule an appointment, and therefore I see that we have no more time. It might be my last intervention. But as you say, in Brazil, I would like to congratulate, because this is just extraordinary. And I already knew Minister Temporão. I have known him for many years, but Secretary Patrícia Eller, it was very nice to meet you. You are invited to come in Portugal for a conference. I really enjoyed your how much content you have and everything that you said and your vision. And I want to tell our coordinator that it was a great pleasure to be here in this connection. And I hope that pandemic is over very soon and that we can meet in person in Brazil. Thank you very much, Minister Adalberto. I am going to give the floor to Minister Temporão and Secretary Patrícia for you to say goodbye. Please, Minister. I'm sorry, it's a great pleasure to meet my dear friend from Portugal, Adalberto, to meet Patrícia. I learned a lot, very interesting positions, and Leandro, very good coordinating and asking questions that were provocative and that encouraged us. And Adalberto, I need to go to Portugal urgently. I was born there. It's my second country. I can't wait for this nightmare to be over and go see people in person. Thank you very much, Minister Temporão. Now, Secretary Patrícia, I had a class here I would like to thank, and for us to stick together against the coronavirus, also paying attention to the positive legacy that we may generate, firm on behalf of health, truth, and lives. People need hope. So let's stay together and keep steady on this journey. Thank you all very much. I'm going to close our panel. Thank you very much, Secretary. Let us all fight for a better society.